the medical answer to that is yes. So, for instance, HIV, if it goes untreated, it can cause HIV dementia. Syphilis is also a condition. If it goes untreated, we can develop tertiary syphilis, where it can actually end up in the brain and have mental health changes, psychosis, and definitely severe psychiatric and mental health issues. But that's usually last resort. So the idea is to get screening and tested as soon as possible. But from a more emotional, psychological aspect, having an STI can cause a lot of shame and guilt because of the stigma around it, and that can have a negative effect on your mental health. Yes, definitely. So I think the most important thing there is really to talk about it, and I often see it in my practice, and I started labeling it as STI phobia, that if you've had one STI, you are worried that anything going on in your body is another STI, or is it a sign that it's coming back. And I think education on what signs of STIs, and if we get tested and we have symptoms that gets resolved and we can actually prove that the infection is not there anymore, then we know we've got peace of mind. And I really think about some of my patients where I really refer them to psychologists and counselors so that they can get psychotherapy to break down the stigma and the self-shame that they've got around it. But definitely we can improve that just with proper education, communication, and getting help.